nurse, and I hear you're in a little bit of pain.
Yep, I am.
All right. Well, I've got some morphine to help with that, and then I also have some antibiotic to help with your pneumonia.
Ah, sounds good.
All
Thank
right.
you.
Can you tell me your full name and date of birth?
I'm Earl Johnson, and date of birth is
12/12/38.
12/12/38.
And do you have any allergies?
I do not have any known
You
allergies.
don't have any allergies. All right. I'm gonna just take a few minutes to get everything prepped, and then I will be giving you your meds in just a minute.
Okay,
Okay.
great.
All right. So I'm gonna put some hand sanitizer on. I'm gonna grab some gloves
Okay.
for later. And all right. So I'm gonna take his MAR. So we've got morphine for Mr. Earl Johnson. I've got some morphine sulfate. It is clear, and the clarity is it's colorless, so it's good. It doesn't expire until 2025, so it's good to go. I've got Earl Johnson, 12/12/38. He doesn't have any allergies. I've got morphine, right drug. I've got I have an order for 2 milligrams. So I've got the right dose, and here it's 2 milligrams per mil. So I'm just gonna pull up 1 mil of morphine, and then it's gonna be given IV. So it's the right route. It's gonna be given now. It's 10 o'clock. So it's the right time, and it's for moderate to severe pain, so it's the right reason, and I'm going to document it later. So I'm going to pop the cap, and I'm going to scrub it for at least 15 seconds, and while that's, so 15 seconds, and then while it's drying, I'm gonna get my syringe ready. So I've got all right, so now I'm going to pull up 1 mil because it's 2 milligrams per mil, and it's a 2 milligram. So I've pulled up 1 mil of air, and I'm going to stick it in the bottle, inject the air, and then pull up 1 mil. Then I'm gonna have my second nurse. Once I get it pulled up here, I'm gonna have my second nurse come and check, and I will say that I have 1 mil of morphine for Mr. Johnson for his pain, and then we'll need to waste the rest of it in the Pyxis when we're done.
Okay.
All right, so then I'm gonna pull it out and one-handed scoop it back on, and we will waste the morphine. And then I need to dilute it in at least 5 mils of saline here. So I'm just going to sterilely take this off and take some air or some of the liquid out, just so I have some room to put the morphine back in. A little bit more. And then I'm going more than that. So I've got at least 5 mils, and then I'm gonna pull back, and I'm going to insert the morphine into there and discard this in sharps and sterilely reattach that. And then I'm going to label it with his name, Johnson, 12/12/38. He doesn't have any allergies. It's morphine, 2 milligrams, and it expires 6 June 2025. Then I'm gonna throw all of that out and label his syringe. And then I need to do a flush afterward. So I've got a flush ready to go. So those meds are ready. Have the second check done. Now I'm going to get the antibiotic ready. So I've got ceftriaxone. The bag is intact. It's clear and colorless. It doesn't expire until December of 2030. So I'm going to go ahead and proceed to prep it. So we've got Earl Johnson, 12-12-38. He doesn't have any allergies. This is ceftriaxone, the right drug. It's 1 gram suspended in 50 mils of normal saline. So it's the right dose. It is due now at 10. So it is the right time. We're going to give it IV, right route, and it's for pneumonia, right reason, and I'll document it later. And both the ceftriaxone and the morphine are compatible with the current IV fluid that's running right now. It's just normal saline. So they're compatible. And so now I'm gonna get ready to prime the bag here. So I'm gonna hang it up here, and I'm going to undo that and open this up. I'm going to hang this here. So then I'm going to make sure this is closed, and I'm going to sterilely attach this into the bag. And it's kind of hard when you're short, but it's going. All right, and then I'm going to take this cap off here and hold on to it so it doesn't get contaminated. And I'm going to slowly make sure the fluid's coming out, and once I've got it going, I will recap this and let it hang. I'm also going to label the tubing. So got my initial. It's going to start at 10 o'clock, and then the discard time later. And I will attach that to the tubing here. All right. So now I'm ready to give Mr. Johnson his meds. So I'm going to do hand sanitizer again. Put on some gloves. And all right. Got alcohol swabs here ready to go. All right, Mr. Johnson, I am going to give you your meds now, but can you first tell me, does your IV site hurt at all?
Not at all.
No? All right. And I don't see any redness, any swelling. I don't see any occlusions or infiltration, so I'm going to go ahead and proceed. Have you ever taken morphine before?
Yeah, I have.
You have? All right,
Yeah.
so you know it works pretty quickly, but I just want to remind you that it could make you dizzy or lightheaded. So if you want to get up, please give a call on your call light, which is right here, and I will come and help you get up. All right?
Okay, thank you.
Yeah, no problem. Alrighty, so I'm gonna go ahead and scrub this for 15-ish seconds. And before I do that, I'm gonna do a third med check before I give it. So I've got Earl Johnson, 12-12-38. He doesn't have any allergies. I'm giving morphine, 2 milligrams, and I'm giving it now via IV for moderate to severe pain. So I've got that, and I'm going to scrub it again one more time just in case it got any inflammation. Alright. So while I'm giving this, Earl, please let me know if you have any pain or anything while I'm doing it. Okay?
Alrighty.
Alright, so I'm going to do this, and then I'm going to give this over 5 minutes. So I'm going to go ahead. And if there was a bread clip, a connector, I would have undone it. And so it's been 5 minutes. I'm going to discard that after I'm done, and then I'm going to pull this off. Without touching the hub, I'm going to, this is just saline, Mr. Johnson. It's just to make sure all the IV fluid gets into your body and you get all the meds, okay?
Okay.
All right, in some places you would scrub it again, but we're not going to do that here. So then I'm just going to give some saline to him, and then I'm going to just pause that for a minute, and then I'll look in. And then once that's done, then we're good. And then I'm going to discard this in the sharp. And so now I'm going to get ready to attach my ceftriaxone. So I've got Mr. Earl Johnson, 12-12-38, no allergies. I'm going to give 1 gram and 50 mils of ceftriaxone. I'm giving it over 30 minutes, now at 10, so it's the right time. I'm giving it IV, so it's the right, it is the right route, and it's for pneumonia, it's the right reason. Giving it now, right time, and so I'm going to go ahead and scrub. I'm going to move this down so that it'll come from this one, and then I'm going to scrub this. Then when I was priming this, I should have filled it half full, but I did that now. So scrub this for 15 seconds, the port above the pump that's closest to the saline bag. And then once that's done, I'm going to detach this and insert this. And then I'm going to just undo that. And then I'm going to program it as a secondary. The rate is 100 mils per hour because it's 50 mils per 30 minutes, and the total amount is 50, and we're going to start it, and I'm going to make sure it's going here. So it should be going. All right, Mr. Johnson, your call light is right here. Is there anything else I can get you before I go?
No, I think that's it.
No? All right. So I'll be back in 30 minutes just to make sure that your antibiotics went through and to see how you're doing on the morphine. But if you need me before then, go ahead and give me a call light. Or hit your call light and give me a call.
Okay, thank
All right?
you.
Yeah,
I appreciate it.
All right. And then I would document. So I just gave ceftriaxone at 10. I also gave morphine at 10. I put my initials, my signature, and Winfield, good Sam, student, nurse. And that is, and then as I'm leaving, I would hand hygiene again. All right?
Okie dokie.